Hello, and welcome to A Health Podyssey.
Health insurance is critically important, it's challenging, it's difficult, and it's doable. Sick leave should be a cakewalk for us in comparison.
I'm your host, Alan Weil. Most of us think of paid sick leave as a benefit for us and our family members, but there's societal benefits to paid sick leave as well. Since 1993, the United States has guaranteed access to unpaid sick leave through the Family and Medical Leave Act, or FMLA. But that guarantee leaves out a large number of workers. A growing number of U.S. states and localities have sought to fill in at least some of the gaps of the FMLA, but many remain. Access to sick leave, both paid and unpaid, is the topic of today's Health Podyssey. I'm here with Jody Heymann, Distinguished Professor at the University of California, Los Angeles, Fielding School of Public Health, Luskin School of Public Affairs, and David Geffen School of Medicine. Dr. Hyman and colleagues published a paper in the September 2021 issue of Health Affairs documenting how FMLA eligibility requirements contribute to racial and ethnic disparities. They found that FMLA eligibility restrictions exclude over half of private sector and self-employed workers from coverage, and there are higher rates of exclusion among female, Black, Indigenous, and multiracial workers. Further, the United States stands alone in having such a limited safety net when it comes to sick leave. We'll talk about this and more. Dr. Hyman, welcome to the program.
Thank you, Alan. It's a pleasure to be here with you and our listeners.
It's great to have you on. This is such an important topic. Now, I think most of us think sick leave, of course, that's a good thing. But you've studied this in more depth than most of us. Why is having paid sick leave so important?
Well, I think the first thing is sick leave matters so much to people's health. People who lack sick leave are 3 times as likely to forgo care they need. And even small amounts of sick leave, as we saw in New York City when they passed 5 days, it decreased emergency room visits, it increased cancer screening, it improved diabetes and cholesterol care. Really, the health benefits are enormous to the individual, but there are also societal benefits. So, the next time someone gets sick in a restaurant, gets diarrheal disease, gets gastroenteritis, it's important to remember that restaurant workers in the United States often lack paid sick leave and have no choice but to go to work sick. When an elderly parent gets sick in a nursing home or a child gets sick at childcare, often those care workers as well lack sick leave and have little choice, even though they're exposing other people to go to work sick. So it benefits the individual and it benefits all of us that everyone has it.
I think for those of us who have, what are called good jobs with not just sick leave, but general flexibility, it's hard to imagine how constraining it can be to feel like you just don't have the opportunity to stay home. Even if you could handle the finances of it, it's the work security and the job security. Well, in the United States, we did pass the FMLA back in 1993. And again, most of us have probably gotten forms associated with it or something. But what's in the FMLA and why is it maybe not enough?
Well, it was certainly important to pass the FMLA. It was the first time there was any job protection for leave, for example, the birth of a child, or for an individual when they had a serious illness or a family member had a serious illness. But at the same time, the gaps have always been enormous. It's only unpaid leave. It stands out that way by global perspectives, and many Americans can't afford the unpaid leave. And then even the unpaid protection is limited. It's limited to people who work at firms that are at least 50 employees within a certain radius, that work at least 1,250 hours over the past year. When you put all of these constraints together, the majority of Americans are not covered by it.
So, in response, some states and local jurisdictions have adopted their own leave policies. What advantages do those offer? Do they fill in the gaps, all of the gaps, some of the gaps? What do they accomplish?
So, on the one hand, you're certainly better off if you live in one of the states or localities that has passed leave because many of them are paid. So, the good news is you have some coverage. They tend to have fewer limits on who's covered than the federal. But there are also a lot of problems. The first problem is they don't cover the majority of Americans. It's patchwork. It's some states, some cities. Second problem is you wouldn't even want to get to we're far from full national coverage that way, but you wouldn't want to get to full national coverage that way alone because then businesses would have to comply with 50 different sets of rules at the state level, let alone additional ones at the local level. The ones that have passed, again, far better to be in a state with it than without it, but still, many of them also do have limitations. Connecticut is just one example, one of the earliest states to pass. That's the good news. But following in the FMLA's footsteps in terms of limiting firm size. New Jersey passed, but also said you have to work at least 20 weeks first. These constraints mean that, for example, people who became unemployed during the pandemic and got a new job, as we have an explosion of Delta, wouldn't have coverage.
I'm struck by the politics. It's very similar when we talk about requiring employers to offer health insurance. The smaller firms are often exempted from those proposals because they seem least likely to be able to bear the cost. But the small firms are the ones that are least likely to offer the benefit in the first place. So when you carve them out, you leave a lot of people without the benefit. I gather that's a little bit what's going on here with sick leave as well.
Yes, and I think one of the things that's really important to note, because in the United States, we take it for granted that you have to exempt small firms, that they couldn't make do without. But at least in the case of sick leave, nearly universally, all of the countries around the world, and it's 180 of them that have paid sick leave, they cover all firms. They do not exempt small firms. They might give more financial support to small firms, but they don't exempt them. Only 3 countries in the entire world do exclude the smallest firms, and for them, again, they're very limited exclusions. 2 of the countries, it's if families with 5 or less workers have a family business, they're not covered, or a farm with 9 or fewer. No other country excludes employers based on firm size in the way the US does.
So, given the limited coverage of the FMLA, and as you described, the patchwork of state and local policies, ultimately, it sounds like for most employees, access to paid sick leave is simply up to the employer. If your employer offers it, you have it. And if they don't, you don't. And that's paid or unpaid once it goes beyond FMLA or if they're not covered. So, what are employer practices in general? I'm sure there's a tremendous amount of variability, but what do employers do given that it's up to them?
I think there are a couple important big messages about what employers do. One is that they leave a lot of people out. A second is that the people they leave out matter to all of us. So, um, across America, there are big disparities. 54% of Latinx workers have no sick leave from their employer. Now, still, even groups that are better covered, relatively speaking, like white workers, more than a third, 37%, have no paid sick leave. So we're leaving across demographic groups Americans out. And disproportionately, many of those services where people have a lot of human-to-human contact. I mentioned restaurant workers, care providers. They disproportionately lack leave too. So they have untenable choices. I've spoken with uh, elder home care workers where they are caring for somebody, they care about that person, they don't want to get them sick, but they also have children at home, they have rent to pay, and they're going to lose their apartment if they don't go to work sick because they have no paid sick leave. Those are untenable choices.
Yeah, they are. And as you note, they're imposed differentially on different groups. So you mentioned one of the disparities in your paper. I wonder if you could go into some of the others. It just does seem like the burden of this uh, lack of policy, if you will, falls disproportionately, not surprisingly, on some of the groups that are we so often burden. But give us a little more detail from your paper.
So there are disparities or inequalities in who gets sick leave provided by employers. But there are also, as the research in the paper shows, real disparities in even who unpaid family medical leave in the United States covers. So we'll take that firm size requirement, which, as you noted, is common across many areas in the US. So, what does it mean? Well, 42% of Latinx workers work at firm sizes smaller than 50. That is more than white workers, more than Asian workers. So they are disproportionately excluded by this criteria that, again, no other country has such a widespread exclusion of small firms. When it comes to part time work, not meeting the FMLA's 1,250 work hour minimum, that's true of nearly 17% of women, while it's just under 10% of men. So there are gender differences. Again, a criteria that's very rare on the global stage. So 96% of countries globally cover part time workers. So the US excludes them, but it's rare. We see the same thing in terms of 1 year tenure. I'm sure that many of the listeners are familiar with the fact that this period of high unemployment we just faced amidst the pandemic, while it was widespread, it hit communities of color worse. That means as people return to work, they're more likely to be new to a job and again not meet that minimum time in the particular job requirement that the Family Medical Leave Act has. Most of the world does not require that.
I'd like to talk some more about sort of the origins of these policies since, as you note, they have such disparate effect and they're unusual by global standards. Let's have that conversation after we take a short break.
Perinatal mental health issues, including perinatal depression and other mood disorders, affect many individuals in the US and globally, and can lead to harm to birthing people and children. The October issue of Health Affairs features a cluster of papers on this important topic. It covers issues such as screening and access to treatment, health equity, and policy opportunities. Check the show notes to order your copy today.
And we're back. I'm speaking with Dr. Jody Hyman about sick leave policies in the United States. And before the break, we were talking about some of the exclusions and how unusual they are by global standards. So you've mentioned firm size, you've mentioned part-time, full-time work, and that these are not common conditions on having sick leave in other parts of the world. I wonder if you could comment at all on sort of why we've adopted both the hands-off approach of leaving it to employers to decide, and then when we have stepped in, we've stepped in ways that continue to leave so many people out.
So, as a country, we have acted as if it's not affordable to have national coverage. And that's an argument that's disproportionately been made by business lobbyists. And here I am purposefully distinguishing lobbyists for groups of businesses from business leaders themselves. Because, of course, there are many businesses that have voluntarily provided strong leave, that are strong advocates for it, that have demonstrated its feasibility. I think the good news about the global research is it does make clear this is totally within our reach. This is a solution we can afford. The feasibility has been demonstrated in a wide range of economic and political settings. And the pandemic has reminded us that doing nothing is so often far costlier than doing what we need to do.
I have to say, listening to you, it's just so reminiscent of conversations about health insurance, about whether it's affordable, who's arguing which side, how the rest of the world seems to figure these things out and remind us that they're possible. Um, so the dynamic is clearly present in areas beyond sick leave. We did have this recent experience where there was emergency paid sick leave related to COVID. Can you tell us a little bit about that policy? I know it's not very long ago, but I wonder if it's taught us anything new about policy related to sick leave.
So, emergency paid sick leave was passed relatively early in the pandemic. So, before we saw the biggest numbers. Even early in the pandemic, it's already been demonstrated that it led to a reduction of one case for each just over 1,000, 1,300 workers. Now, presumably later in the pandemic, when there are follow up studies, we'll see the reduction was even greater because there was much more spread. But we didn't need the pandemic to teach us this. Because of the passage at the city and state level of paid sick days, people had already studied what does this do to the spread of influenza, another respiratory illness, which, by the way, every year costs billions of dollars in lost productivity. Well, the passage of paid sick leave leads to a reduction of influenza of 30%. So it's a marked reduction. And since you've raised a number of times sort of the relationship between the arguments of sick leave and health insurance, I do want to mention one thing. And I will say this as someone who does believe in the feasibility and importance of strong universal coverage for health insurance. Health insurance is critically important, it's challenging, it's difficult, and it's doable. Sick leave should be a cakewalk for us in comparison. It's less costly, there are fewer systems that have to change to make it affordable, and we're paying a very high price now for not doing it.
Well, I appreciate the reminder, and you're absolutely right. I mean, the dollars involved are really different. Um, the natural inclination, I'm sure, of many listening is to say, well, just mandate more expansive sick leave, mandate it to be paid, or mandate it to reach some of the populations that aren't currently reached, eliminate some of the exemptions. Um, but I assume there's more nuance than that, and some of it has to do with who pays for what. So, what are some of the options for modifying sick leave policy in the United States?
I think the most important questions are how to do it. And I think the best practices from around the world and the most readily implementable combine an employer role and a government role. So, in terms of short term leave, 7 to 10, the first 7 to 10 days a year, those would very commonly be employer mandates. And there are a couple reasons for that. One, it's very affordable for employers. It's a relatively short amount of time, across the United States, firm sizes of all different size have shown its feasibility. And administering that as a social insurance program would be a big problem because then you have to verify short-term leaves, et cetera. So just from a pragmatic standpoint, much easier for those short leaves, the total of 7 to 10 days a year, to be employer-based. At the same time, I think it's well demonstrated across countries that the longer leaves are affordable to have social insurance for. So 3/4 of high-income countries do guarantee social insurance for 3 months or more of sick leave, and 2/3 of all countries do. But that longer leave, it does make sense to do as a social insurance program, just as parental leave would be, so that it can be shared across firms, and so that a small firm, which could readily afford 7 days for an employee, if they have 5 employees, isn't disproportionately affected by the long-term illness of a single person.
So this blending of socialized, if you will, and individual firm responsibility does seem to make sense, I guess would be the right way to say it, given the arguments you pose, particularly about just sort of the complexity of running a public system for a few days of coverage. Well, I recall debate as there was discussion of extending unemployment benefits, another patchwork safety net program that leaves many people out. And the concern that if you're too expansive in those benefits, that people won't go to work even when their job's available. I wonder, is that part of the rhetoric here? The notion that if there's too much sick leave, it's not just that people who are sick will stay home when they should, but that people will abuse the system and not really be sick?
So I think the questions around unemployment insurance, as well as some of the broader sources of checks that occurred during the pandemic and income sources, is different. One of the issues that was raised there is that for some people in some poorly paid gig economy jobs, they were earning more. They had more take home income by not working. That clearly would affect whether most people would seek a job, especially if it was a high risk exposure during the pandemic and not a highly rewarding job. There are none of these sick leave policies would people earn more or have more take home pay than working. All of them are pegged at less. So I think that's a first crucial difference. And the second thing is that here there's actual verification built into almost every social insurance system that you need to be home sick. I think part of the reason that one keeps the long-term absences in a national social insurance system is to have a rigorous way to verify, as well as to make it affordable. And part of the reason you have the short term with the employer is they are local and very aware of whether the person actually is sick. But again, none of these are setting up situations where people have more take-home income when they're not working.
Oh, that clarification is really important, and I appreciate that. Well, this has been a really interesting conversation, and it's very clear from your work that there are, as you said at the outset, societal benefits associated with paid sick leave that go beyond the individual person or family or employer. And it is interesting that we delegate to employers to make this decision about something that has such broad societal effects. But that is where we are, at least today, once you get past the FMLA and a few states and localities. The link here between sick leave and broader issues of health is quite clear, and I appreciate you in improving our understanding of that relationship and the disparate effects of the current policies. Dr. Hyman, thank you so much for your research and for being my guest today on A Health Podyssey.
Thank you, Alan. And to everybody listening, I would just say that right now, Congress is deeply engaged in considering these issues. So think about them, learn about them, share your views with people who represent you, because now is a time that collectively we can decide whether, as a country, we want to catch up with the rest of the world. Thanks very much.
Thanks for listening. If you enjoyed today's episode, I hope you'll tell a friend about A Health Podyssey.
Health Podyssey is produced by Health Affairs, the leading journal for health policy research. The team behind the show includes Patty Sweet, Jeff Byers, Julia Vivolo, Sarah Kolk, and Sue Ducat. Like the show? Subscribe to A Health Podyssey on Apple Podcast, Spotify, Stitcher, Google, or wherever you listen to your favorite podcasts. Thanks for listening, and have a great morning, day, or evening.